My dear students, today I would be taking up a topic, Friedreichs Ataxia. Now, we have got these two important conditions in neurology. One is the Guillain-Barré syndrome and this Friedreichs Ataxia. Now, about a brief description about Guillain-Barré syndrome, I have mentioned that it is an acute inflammatory polyneuropathy characterized by a previous history of GI infection followed by paralysis and ascending type of motor paralysis and characterized by albuminulocytological dissociation in CSF. The CSF counts would show increased protein levels but decreased cell counts, and in addition to that, the treatment by virtue of intravenous immunoglobulins and plasmapheresis. Leaving that aside, today our focus would be more on Friedreich's ataxia. As far as Friedreich's ataxia is concerned, you have to remember that this is a disease which is common in children, number one, and it is the most common of inherited of ataxias. Ataxia, is associated with the problems in gait, problems in balance, and Friedreich's ataxia happens to be one of the most common types of inherited ataxias. Now, it follows an autosomal recessive pattern of inheritance. And what is important is that you have to remember this gene, the frataxin gene. The frataxin gene is implicated in certain cases of Friedreich's ataxia. In addition to that, you have to remember that there is this important group of disorders which we call as trinucleotide repeat disorders. We have those trinucleotide sequences repeating themselves and causing certain diseases. And Friedreich's ataxia has got this repetition, GAA repetition, in its sequence. In addition to that, that's important. I will be coming to that at the end, why this repetition is important. In addition to that, you have to remember a child would present with gait, with a stumbling gait, with a staggering gait. He would not be able to maintain his position, his balance, and he would fall, recurrent falls as a result of unstable gait. And then you can have associated symptomatology or signs in the form of nystagmus, dysarthria, and dysmetria. Now, one point to remember about this neurological condition is that you have got associated features like the presence of kyphosis, scoliosis, lateral bending of the spine, or the presence of pes cavus in the foot. So the sole of the foot would be just too much convex in the form of a cave, pes cavus, which we call. And in addition, you have to remember that these children can be having frequent cardiological problems in the form of cardiomyopathies. And one peculiar feature about Friedreich's ataxia is that you can have the involvement of the posterior columns of the spinal cord, the fasciculus gracilis and the fasciculus cuneatus, which we also call anatomically the dorsal column medial limniscal pathway. And this pathway or these tracts are important in transmission of position and vibration sense. So a patient with Friedreich's ataxia can be having loss of position and vibration or decreased perception of position and vibration sense. So this is some of the important information about Friedreich's ataxia. Now, how do we diagnose this condition? I told you at the initiation of my class that this trinucleotide repeat pattern is important. Why? Because genetic analysis of this trinucleotide repeat pattern is important in diagnosis of this condition. So this is some information about Friedreichs Ataxia. So I hope that you just revise these points very nicely and expect questions from some neurological conditions like Guillain-Barré syndrome, Friedreichs Ataxia, Ataxia telangiectasia, as well as certain other conditions. But these three conditions, just remember them. Thanks a lot.